rotator cuff surgery it's a tough recovery, just to be frank. It requires a lot of rehab. It requires diligence in terms of paying attention to your post-op instructions. The sling is vital. If you start moving a shoulder right after cuff repair actively, if you're dealing with little anchors and sutures and bad tissue, it could fail. So the first 6 weeks is critical. We're in the sling doing what we're asking in terms of letting the shoulder move under the power of your other arm or a therapist or a friend or spouse, and not really starting active motion even at all until like 6 weeks. And then even at that point, for the next 6 weeks, so up to 3 months post-op, we're just really working on active motion. Really not to tell people no weight, no resistance. Sometimes you use little 1 or 2 pound bands, but nothing real heavy, because once it's healed, now you want it to get stronger before you really stress it. So usually that first 3 months is challenging. I actually joke with patients sometimes and say, these first 3 months, maybe you're better off seeing a psychiatrist than me, because it's tough. I mean, there's no lie. And then really 3 months things really start to improve. But generally speaking, it takes a year for full recovery, and that doesn't matter if you have a tear that's a little 5 millimeter tear or if it's a big 5 centimeter tear. But most of the time, the biggest recovery or the biggest gains usually happen really between 4 months and 6 months. And most time by 6 months, most folks will say, hey, I'm 85%, I'm doing well, doc. But it takes probably another 6 months to get that last 25%. So just keep in mind, it's a slow process. Don't get frustrated. Just keep working, keep doing your part in terms of doing the rehab, and it'll all turn out great.